Alright guys, how y'all doing? My name is Quaylon Ball, and this is my IV video. So I'm sitting at the nursing station, and I'm just going over my patient's notes or whatever, and I see that today I have an IV for Mr. Michael Jackson. So this is what I'm pre-assessing, verifying my order. He doesn't have any allergies, he doesn't have any history of CHF, no renal disease, mastectomy, no AV shunts, no CVA, no or stroke. His lab values are pretty good. His vital signs are right. No impending surgeries coming up, so looking pretty good. So he has Lasix 20 milligram IVP twice daily, and he has Rocephin 1 gram IV piggyback daily, infused over 60 minutes. All right, so now that I'm done going over my patient's charts, I'm going to go to the medicine room. Before I go in there, I'm going to perform hand hygiene, and I'm going to get my supplies that I need. So for my supplies, I will need the IV starter kit, tourniquet, alcohol pads, my flush, which is a 10 milliliter flush. We have the 20 gauge syringe for my IV, my tape. I have the transparent dressing. My patient today is Michael Jackson. All right, so I enter my patient's room. I perform hand hygiene. Hello, Mr. Jackson. How you doing? My name is Quaylon Ball. I'll be your nurse today. First, I'll identify you by your ID badge, Michael Jackson, and your date of birth. All right, that's correct. Have you ever had an IV before? You have? Okay, that's great. Are you allergic to anything? Shellfish? Okay, great. So the doctor has ordered you to get an IV today, and what I'll be doing today is giving you an IV catheter in your hand. So without further ado, let's get to it. So I clean my area off. Everything is clean. My bedside table is clean. I disinfected everything. So I'm gonna organize my supplies now. I'm going to use my sterile techniques to open my packages. So I'm just going to open it and keep it in there on my bedside table, get everything organized. Right, my tape is there. My gloves are ready. Right. First, now I'm going to prime. I'm going to open my saline block extension tubing. And how I'm going to do it, because I want to keep it sterile, I'm not going to touch this top. What I'm going to do is I'm going to flush my 10 milliliter syringe in it. Get this little air bubble out of here. Okay. The air bubble is gone. Get this. I'm gonna twist. I'm gonna flush until I can see it. All right, get it to the top. Then I'm gonna put my lock on it and place. I wanna open my top. I'm gonna just lay it in this little bolt right here to keep it sterile. All right. I'm sticking to the edge of the bed. Mr. Jackson, have you ever had any IV problems in the past? You haven't? Okay, I'm gonna check for any edema. your jugular vein distension, any skin trigger. I'm going to also listen to your lung sounds. All right, okay, Mr. Michael Jackson, your lungs are beating it. Yes, they are. All right. No allergies to latex, allergies to iodine, any of that. Okay, no. All right. Let's look at the possible IV site. I'm going to get my tourniquet. And also, since this is clean, I'm going to lay my protective 4x4 under your hand. And I'm going to put the tourniquet up under here, about 4 to 6 inches above the insertion site. This is my tourniquet, 4 to 6 inches above the insertion site. Easily, I can just pull it and it'll come off. All right. So what I'm going to do is, while I have the tourniquet on, I'm going to get an alcohol pad to see exactly which vein do I want. So I'm just going to rub down. Okay, to see which vein I'm gonna do. So I see this vein right here is looking pretty good, and Mr. Jackson has some pretty good veins. All right, so after I found the vein, and could you open and close your wrist, your hand for me? Okay. All right, I'm gonna lightly stroke the vein downward. Okay. All right, so I'm gonna release the tourniquet, and I'm gonna perform hand hygiene. All right, I'm gonna put my gloves on. All right, my gloves are on. I'm gonna clean the site with the alcohol pad, and I'm gonna clean not just the site but around the site, just in case Mr. Jackson has some rolly veins. I can get them. I might change my mind and get those. All right, clean the site off. Let's reapply the tourniquet. All right, the tourniquet is applied. All right, we're going to anchor this vein. We're going to get our needle ready. All right, now that I have my needle ready, I'm gonna anchor the vein, pull the skin below the puncture site with my thumb on my non-dominant hand. All right, Mr. Jackson, I want you to relax, okay? It's gonna be a sharp little pick, but it shouldn't hurt too much. I'm gonna go in bevel up, and the needle isn't gonna go in the vein. I'm gonna go about 15. Go in a little more. What I want to do is down, even on the skin. Right, bevel up. It's about 10 to 30 degrees in there. Punch the skin. Look for the flashback of blood, and I see it. That is beautiful. All right, I'm going to advance the catheter about a fourth inch in the vein. While I'm holding the skin, I'm going to advance the catheter off until it rests on the skin. Safety on. I'm gonna put this needle in my sharps container. While the needle is still in there, I'm gonna take off the tourniquet, then take out my needle. Safety, put my sharps container. Now, the needle removed, I'm gonna stabilize the catheter with my thumb and forefinger. I have this open. It's already stable, so I'm just gonna put it on the catheter. Twist. Right, I'm gonna aspirate 1 or 2 seconds. Then I'm gonna flush. And I'm watching the IV site, making sure there's no swelling as I flush. All right, and I flushed. Now that I have flushed, I will put tape up under the IV site. And I will not put tape over the punch site. Right, put it down like this. I'll go chevron, meaning go over. And I'll put another piece of tape on top. Now that the tape is on there, I'll get my transparent dressing and put it over it, but I will not cover the junction. To keep it sterile, just apply here. The less wrinkles, the better. It's not over the junction, so what I'll do is I'll grab bottom, go up, put my finger on it as I come across. Right. And I put a piece of tape on this part that's sticking up as well. Right, and on that I labeled the time, the date, my name on the transparent dressing is on there. Now I will dispose of everything in the sharps container. I will take this dress on here, remove my gloves, and how I would do it is grab the inside and just pull it off, get my finger, go up under here, don't touch the gloves. All right, put this in the trash. All right, the doctor has ordered. All right, this is my documentation after leaving Mr. Michael Jackson's room. All right, June 10th, 0900, 1 attempt. angiocath 20 gauge inserted in left forearm, 1 attempt using tourniquet. Connected to saline extension tubing. Blood aspirated and flushed with 10 milliliters non-saline. No sign and symptoms of infiltration. Secured catheter with clear IV tape. Patient tolerated procedure with no pain or anxiety. Instructed the patient to let staff know if IV site come painful, red, swollen, or drainage occurs. Quaylen Ball, student. This is how the arm looks, taped up. Nothing is covering the hub. Punch site. Looks pretty good. All right, so I'm in the medication room. I have performed hand hygiene. My hands are all dry. And I will look at the order tomorrow for my patient, Mr. Michael Jackson, and see what medicine he has for today. So I open up my medicine drawer and I see that he has Lasix 20 milligrams. This is Lasix, and it's more than enough in here, in this vial. Lasix, expiration date 5/23. So we got, okay, good Lasix, 20 milligram, 5/23 from Michael Jackson, All right. I just sit this here. And we also have, oh, all right, a bag of Rocephin. Expiration date 07/23 for Michael Jackson, Rocephin. Expiration date is 07/23 for Michael Jackson. And the pharmacy wants them to infuse over 60 minutes. 1 gram infused over 60 minutes. All right, so I'll sit this right here. So what I'll need is, I'll open up my pack of my newly 3cc syringe. I have a flush here. Just put it right here. And my area is also clean, by the way. So what I'm going to do is, and I've already done my calculations for my Lasix. So what I'll do is take the top off my Lasix. Get an alcohol pad, wipe it down for about 15 seconds. 15 seconds has went by. All right. So what I'm going to do is get my 3cc syringe. I'm going to take the needle off, sit it here. I'll sit it here so you guys can see. And I'm going to take 0.5, so about half a milliliter of air, half a milliliter air, 0.5, and put 0.5 of air in the Lasix. Now I'm going to go up, pull 0.5, right, and I'm going to scoop my needle, my 3cc syringe with 0.5 Lasix in here. So scoop it, grab the top, make sure it's on there. Put this on a label, which says Lasix. Now that I have my Lasix ready, I will begin to set up my IV pole. So I will need some normal saline. And I will also need some tubing. And with this tubing, I'm gonna go ahead and press the clamp, the roller clamp down so I can get ready to spike it. Then my tape. Okay. This is my IV pole. So what I'm going to do is I'm going to put the normal saline at the bottom of my IV pole. And this is my sink area. So what I'm going to do is, I'm going to open my clamp. I'm going to press on the dripping part, and it's going to come out to the sink. Make sure no air bubbles are in it. All right, I spiked it. So now I'm going to close the clamp down and just sit it up here. Now I will get some more tubing out for my antibiotic, my Rocephin. I'm gonna close the clamp down. Down. Get my tape for my Rocephin bag ready. And I'll put the Rocephin at the top of my IV pole. It has a hook on it, just because I want to lower it. So Right, I'm going to spike this one as well. But since this is my antibiotic, I don't want to waste a single drop. So I'm going to open the clamp, push it up, squeeze a little bit, and watch it come all the way to the bottom. Not going to come out. And as it gets to the bottom, no air bubbles, I'm going to stop it. I'm going to close it, pull it down. And what I'm going to do is, have the Rocephin infused with this IV, and I'm going to put it under the closed clamp. My normal saline is that. So up under the clamp. And this is my IV pole. Now that I have all of my medicines together and ready and calculated up, I will check one more time just to make sure that I'm confident everything is correct. I have everything labeled, and I'm confident in the medicine that I will give my patient, Mr. Michael Jackson. So we have the Lasix 20 milligram, and I have it calculated for 0.5 milliliters in this 3cc syringe. It's labeled Lasix. Expiration date 05/23. Michael Jackson for Michael Jackson. All right. My Rocephin, 1 gram infused over 60 minutes for Michael Jackson. Expiration date 07/23. My normal saline, it expires 07/23. I'm confident that it is correct. And now I will go to my patient's room. Now that I'm in my patient's room, I have performed hand hygiene. Hands are dry. How you doing today? Can you tell me your name, please? Michael Jackson. Okay. Can you tell me your birthday? 8/29/1958. That's correct. You can see your name, your ID band. Number 123123. Okay. Thank you so much. How's that IV been? Has it had any pain today? Tingling, swelling, redness, warmness, drainage? No? Okay. That's great. That's very great. Do you have any allergies, by the way? No allergies? All right, great. So, your medicine for your IV push is in, and I will tell you what those are. So, you have Lasix, 20 milligram, and I have looked in the drug book, and this is an appropriate rate to do for IV push over 1 minute, the Lasix 20 milligrams. So, it's 0.5 milligrams in the syringe. All right, so, and you have your Rocephin, and your Rocephin reads 1 gram IV piggyback infused over an hour. I've also checked that in my drug book, and that is an appropriate rate for this Rocephin to be infused over an hour. All right, so I will put an sterile drape beside my patient. I will put some gloves on. All right. I'll put my supplies on my sterile drape. So my pushes, my 3cc syringe, a few alcohol pads. So what I'm going to do first, open up an alcohol pad. I'm going to wipe off IV in about 15 seconds. And I'm going to open my flush. This is a sterile top, so take it off. I'm going to put it on and turn. I'm going to unclamp the IV. I'm unclamping the IV. So I'm going to aspirate for blood. And I got some good blood. All right, there's the blood. That's great. So now I'm going to push. Flush. All right, now that you're flush, I'm going to grab it, stabilize it, turn, take it away, put it here, get another alcohol pad, wipe it off. 15 seconds. Now I'm going to get my medicine, my Lasix. Going to take this needle off, put it in a Sharps container. Put it here, turn it. And what I'm going to do is I'm going to infuse a fourth of it every 15 seconds, which makes a minute. 15 seconds, 15 seconds, 15 seconds, and the last 15 seconds. All right, gonna take this off, safety, put it in my container. Another alcohol pad, I'm gonna wipe it off. Again, 15 seconds. Now I'm gonna do my last flush, but this time I'm gonna wipe it off. So this time, twist it, but I'm gonna infuse this flush at the same rate that I did my Lasix. So every 15 seconds, a fourth. 15 seconds, 15 seconds, 15 seconds, 15 seconds. Get off. Alcohol. And I'm going to clamp it. Clamp this IV. All right, now that I gave you your Lasix, I will give you your IV now. Tube. I'll open up a new alcohol pad to wipe off. This is for 15 seconds. I'll take off the stirrer cap of this. Take off. I'll put it here and twist. Put the tape on here so it'll stay. Okay. Now, I will open your tube for your 07, and I will play with the one for your main tube to see. So according to my formula, it should be 100 milliliter per hour, 25 drops per minute. Okay, so about 25 drops per minute. I'm looking for about 6 drops every 15 seconds. So according to my watch, I'm gonna keep playing with your main tube. Okay. 15 seconds. 15 seconds. Okay, about 6 drops. That's just what I want. Now I'll do it for a full minute to make sure that you get 25 drops, at least 25 drops. Full minute goes by, you do get the right amount of drops. All right, that's great. All right, Mr. Michael Jackson, I have your IV in. Do you notice any pain, anything strange happening? No? Okay. Well, what I'm going to do is I'm going to just listen to your lung sounds. Okay. No jugular veins distension. Let me check your skin sugar. All right, that's great. Okay. That's great. Right. I'll clean up my mess. Get my mess out the way. Take my gloves off. Throw my gloves away. Perform hand hygiene. Place the bed in the lowest position. Call, light, and reach. I am documenting the time that I gave the IV on the MAR. 11:26 p.m. I will document the time. If you need anything, just call me. I will be here to help. You have a great day. Okay, so an hour has passed, and I have an order to discontinue the IV from Michael Jackson's hands. So before I do any of that, I want to look at his chart to make sure there's nothing abnormal that I need to report to the doctor, just in case he, might says don't take it out if I find something pretty abnormal. So let's see. His urine output is pretty good. His white blood count isn't elevated, so there's no signs of infection, no fever. His lab values look pretty good. Even his tolerance to oral fluids, pretty good, okay? All right, so there are no abnormal things to report to the doctor. So now I got that out the way. I will go to the medicine room to get my supplies. So I'm in the medicine room, hand hygiene, and what I'll need is my gauze, my alcohol pads, and some tape. Now I'm in my patient's room, perform hand hygiene. All right, Mr. Michael, how you doing today? How's that IV been going? No problems, no pain, tinglings, warmness. Okay. Can you tell me your name, your birthday, okay, and your number? It's the same, okay? Great. Are you comfortable? You are? All right, that's great. This is a comfortable height of the bed for me. So today I will be discontinuing your IV. Your R7 has only been infused for 60 minutes and it's done now. So I'm going to get to it. I'm going to put some gloves on because anytime we work with IV, I'm going to have some gloves on. I'll place a pad underneath the hand, put my supplies here, my gauze, my tape, my alcohol pads. All right, now, all right, I am clamping the primary and secondary tube and disconnecting from the extension tubing. All right. Yep. Now I am pouring the unused fluid in the sink. All right. So now what I'm going to do is I'm going to take the tape off of your IV. If you have any pain, just let me know. I'm going to try my best to get all this tape off out of here, okay? And I'm also stabilizing the site as well. I don't want it to come out. Very sticky, so I might need a little adhesive. Okay, there we go. The tape is coming off, okay. And I'm taking the transparent dressing off now. What I want to do right now is take my alcohol pad and clean the site. I want to do it gently. I'm not pressing hard at all. All right. Now that I did that, I'm going to take my first gauze and put it right on the site. Now I'm going to gently take out the IV while I'm holding pressure on my gauze. While I'm holding pressure, I'll be looking at my IV and it looks a good length. It looks pretty good. You did very good, Mr. Mike. So I want to hold pressure for about 30 seconds. Then I will take my peek. Okay, I'm taking my peek and it stopped bleeding. So hold it just a little more. I'm going to get a clean gauze. I'm going to place it, after I move it, I'm going to place it on top here, okay? Place it on top of the site, the clean gauze. Now I'll get my tape that I had already ready and place it on top. Let's see. And also, I would never use scissors because I might cut the catheter. Never use scissors for that catheter. I'm assessing the site for symptoms of infiltration, inflammatory as well. Alright, got it on there. Now, Mr. Jackson, notify me or any staff of any bleeding occurs, any discomfort. It's very important to take in a very good amount of oral intake of anything prescribed treatment plan for you. All right, awesome. You did very well, by the way. I'm very proud of you. I'll move this away from your hand. Clean up my supplies. Trash my supplies. I'll take my glove off. Perform hand hygiene. Return to bed in the lower position. Mr. Jackson, if you need anything, just let me know. Your call light is in reach. And you have an amazing day, and it was an honor serving you. To end my video, I will be documenting my discontinuing of the catheter. So, June 10th, 2020, the time is 10:00. The order was received to discontinue the catheter. Angiocath, 20 gauge removed from the left hand. Catheter tip is intact. No redness, swelling, tenderness, nor drainage at the site. Pressure applied for 30 seconds. Bleeding stopped. And 2x2 gauge dressing applied and secured with tape. Patient tolerated procedure with no pain nor anxiety. Instructed patient to notify staff if bleeding or discomfort occurs. Signed, Quaylen Ball, student nurse. Thank you.